Everyone, my name is Joel Brooks, and I'm a physician and assistant professor at the George Washington School of Medicine and Health Sciences and part of the Division of Allergy and Immunology at Children's National Hospital, where I serve as an allergist. Today, I'd like to take the opportunity to talk to you about environmental allergies, and so let's get started. So, what are seasonal allergies? So seasonal allergies, also known as seasonal allergic rhinitis, commonly referred to as hay fever, affects millions of people worldwide. Common symptoms include sneezing, nasal congestion, runny nose, itchy eyes, and it's commonly caused by pollen in the air, although there are other factors as well, such as mold. And it triggers your immune system to respond because your body identifies pollen as an invader. So how can parents help their kids battle these symptoms? Well, the first step in treating seasonal allergies is to identify which allergens your child is sensitized to. An allergist can perform skin testing or blood testing to determine environmental allergies. Once identified, allergists can make specific recommendations aimed to reduce the allergen exposure and treat the symptoms. For example, keeping your windows closed at night, and if possible, use air conditioning, which cleans, cools, and dries the air and reduces pollen exposure. Also, when returning to the indoors, take a shower, shampoo your hair, change your clothes. All these things will help reduce the amount of pollen that's brought in from the outside. And then when it comes to medications, this might include antihistamines such as Zyrtec or Allegra, and intranasal sprays such as Flonase and Nasacort. Finally, allergy immunotherapy, or more commonly known as allergy shots, can be used to treat environmental allergies as well. Allergy immunotherapy involves receiving regular injections given in gradually increasing doses to help your immune system become more resistant to the specific allergen and lessen your symptoms, as well as the need for medications. What has my team seen this allergy season? As we are currently in the spring season, the main pollens we are seeing are tree pollen. As the summer approaches, grass pollen becomes the primary allergen, and weeds tend to shed their pollen in the fall months. Birch, maple, oak, juniper, and poplar are amongst the most common and highest pollen counts in this area. There are many online resources you can use to check the pollen levels in your area, and this includes the American Academy of Allergy, Asthma, and Immunology's website, as well as pollen.com, to get more accurate counts for what's brewing in this neighborhood. So how do we tell the difference between allergies and coronavirus? There are symptoms that are common to both allergies and coronavirus, including cough, congestion, headaches, and fatigue. Fevers and chills, muscle aches, loss of taste and smell, nausea, vomiting, and diarrhea are all commonly seen with COVID-19, but are very rare in allergies. In contrast, itchy and watery eyes and sneezing are more commonly seen in patients and children with seasonal allergies. If there is any question, we do recommend seeking appropriate medical care and testing. And for more information, please visit the CDC website at cdc.gov. Do seasonal allergies make you more at risk for COVID-19? There isn't enough data yet to know whether having seasonal allergies puts you at higher risk of contracting COVID-19 or having more severe symptoms if you do contract COVID-19. Does wearing a mask protect against seasonal allergies? Masks can offer some protection against seasonal allergies because they can prevent some large particles from being inhaled. However, they should not be your only protection against pollen exposure because smaller particles can still get through the covering and be inhaled. We do recommend washing your material masks after each use, particularly if you suffer from seasonal allergies, because the coverings may carry particles such as pollen. Thank you so much for listening and watching this episode of Beer Bites. If you have any follow-up questions, please feel free to leave them in the comments or call my team at 202-476-3016.